Good evening. This is my video on unconscious bias in healthcare. This video is based on a study done by Madeira, Gama, Diaz, and Perea on legitimization of discrimination against immigrants. So the hypothesis used for this study was that healthcare workers, physicians, nurses, and others discriminate against immigrants based on their perceived threat. And there have been many studies prior to this one which have examined discrimination against immigrants because overt discrimination is no longer tolerated in healthcare. So the study hypothesizes that healthcare workers have found another way to discriminate against immigrants, which is the perception of a threat. So this study used a questionnaire format with physicians, nurses, and healthcare workers to examine multiple factors such as prejudice, perceived threat, how much contact the participants had with the immigrants, and the actual biased thought process of the individual participant. Now, this questionnaire measured each of these in various ways. First, with prejudice, they used statements such as immigrants take advantage of the healthcare system, and immigrants do not perform their duties even though they're aware of their rights. If the participant answered yes to either one of those statements, or I agree with either one of those statements, they were deemed as prejudiced. To determine the health threats, which is the whole crux of this experiment, they use statements such as immigrants pose a greater risk to public health, and immigrant diseases were obtained with high risk behavior. Answering I agree to either one of those statements meant that you had a perception of a health threat, even if you weren't aware of the patient's history. Healthcare bias was also used on the scale of I agree or disagree, such as immigrants' care takes longer. If the provider agreed with that statement, they were considered to have healthcare bias. Or, I am more likely to make a mistake when caring for immigrants. Or, it is hard to establish a good working relationship with immigrant patients. If they answered I agree to any of those, they were considered to have healthcare bias. The last factor was the easiest to measure because the healthcare workers quantified how much contact they had with immigrants within the last month. If they had a significant amount of contact with them, they were considered a candidate for this study. So when compiling the data, the preparers of this study determined that only nurses and physicians' information or data was significant enough to carry forward. Other healthcare workers were excluded. So they randomly selected 40 out of the 80 surveys that were done to determine if there was a positive correlation between the perceived threat of immigrants to public health and the legitimization of discrimination in medical treatments. Meaning that the healthcare workers used the perceived health threat to justify how they were treating the patient and why they were treating the patient differently. So in healthcare, in the world, unconscious bias is dangerous, but in healthcare, it's particularly dangerous because in the balance is someone's life, and everyone deserves to get equal care and equal treatment. So there have been several studies that have been done to address unconscious bias. One study in particular by Bryan and Tenzi examined ways to actually address unconscious bias in healthcare. One such way was considered immersion. If a physician walks into the hospital and is told that their patient is a drug user, usual things that come up is they're drug seeking, they are manipulative, they're thieves, they're liars. Without even knowing the patient, just getting their history. So this study by Brian and Tansey thought to change that by having this physician spend time with one drug user, someone that they've never met before, and get to know them and know how they've come to these hardships, how they got to this place, and how they're feeling about themselves and the situation that they're in. The goal of this is to have them think that the next time they have a drug user, instead of thinking drug seeker, manipulative, liar, they think of Ralph, the drug user that I spent time with and everything that he's gone through. And that you won't have such a negative correlation to drug users because you understand that they have a story and they have a background. And the study also proposed that they don't go through this just one time. They go through this quite a few times throughout their career to just keep them abreast on their skills of being aware of their own unconscious bias and giving them an opportunity to expand on those skills. So in conclusion, this study examined healthcare workers' legitimization of discrimination towards immigrants. And it was done primarily by saying that these particular patients were more of a health risk than other people. And there have been several proposed studies, but we'll continue to look forward and find ways to make sure that everybody is getting equal and fair treatment. The studies used for this paper are here. I don't know if you can see them, but they will be in the description below. Thank you guys for taking the time to listen, and have a great day.